I do neuroimaging in epilepsy, so taking MRI scans of people with epilepsy. That's my main research field. The work that we're discussing at this meeting is looking at trying to get a handle on the problem of whether or not brain abnormalities in people with epilepsy precede the start of their seizures, or whether or not they're a result of having epileptic seizures. So that's an important problem, because if they have abnormalities at the start of their seizures, that might help determine whether or not they are easy to control with medication, or whether or not they'll be what's called medically intractable, which means that they don't respond to medication. The way that we looked at the problem was using recent developments in computer-based analysis that allow us to take an MRI scan and from that scan estimate how old someone is, so their age. That's using a technique called machine learning, which is used in a wide number of applications. In this case, the learning process is we feed the computer a very large number of MRI scans of healthy individuals that do not have epilepsy, along with their age, and the software then learns how to predict the age of someone based on the scan. So once we've built that predictive model using the machine learning approach, we then take MRI scans of people with epilepsy and we separate them into two groups: people that have recent onset epilepsy, so haven't had a lot of seizures, and then people that have had epilepsy for a long time and that aren't responding to medication. And so these are people that are getting potentially assessed to have brain surgery to treat their epilepsy. So what we found are that people with recent onset epilepsy have a subtle increase in the difference between their predicted age from the MRI scan and their actual chronological age. But in people that have had epilepsy for a long time, they actually have quite a significant difference between the age that's predicted using the MRI scan from their brain structure and their actual age. And so someone that's had epilepsy for a long time has a brain that appears to be 5 years older than you would expect for their age. The way that we interpret that finding is that it seems the main difference between those two groups are that the second group has had a lot of seizures. So the way that we interpret that result currently is that seizures have an effect on the structure of your entire brain to age it slightly. Well, with these guys, we already know that their epilepsy is bad and needs to be brought under control. But what they're finding really provides quantitative proof that having seizures has an effect on your brain. And so what it really means is it highlights the importance of getting someone's seizures under control. So to a physician, the really important thing with treating people's epilepsy is the primary concern is to stop them from having seizures from a safety point of view. For example, if you have a seizure while you're driving a car or doing various activities around the house, the risk of injury is increased. With this finding, it's more long-term effects that we'd be worried about, so effects of seizures on your cognitive function and that kind of thing. So what we hope for the application for this method is that if we measure their brain age early in the course of their epilepsy, that might give us some information about whether or not they're going to fall into the group of people that are well controlled with medication, or the people that are likely to have a lot of seizures in spite of being on medication. And if they fall into that second category of being likely to have more seizures, then you can choose an alternative treatment. You might, for example, fast track them for epilepsy surgery, so you don't wait. So currently there's epilepsy surgery for epilepsy, when all the signs are right for it, is a very effective treatment for seizures. But there's currently a very long delay between when you first recognise that they might be a good surgical candidate and when you actually do the surgery, for obvious reasons, because it's very, it's a big thing to go through. So in this case, it might help speed up that decision, or to use there's a bunch of other alternative approaches to seizure management, which you might give those a try earlier. Imaging is a very, it's a relatively new technique. I mean, I guess it's been around, it was invented in the 1970s. It's very important for epilepsy surgery in particular. That's one of the main clinical applications of MR scanning, but it's still getting, still a very rapidly moving field of research, and so there's a lot of potential avenues for imaging. Of all the people with epilepsy, it's actually a fairly small percentage that show an abnormality on their MRI scan. So the real push that a lot of the main epilepsy neuroimaging groups are working on is to try and identify where seizures are coming from in the brain using MRI scanning. And if you can figure that out, then that gives you, really opens up the sort of treatment options. What we are trying to do now is to apply this technique to people with new onset epilepsy, a very big group of them. So this is part of a project called the Human Epilepsy Project. And so basically what we would like to figure out is the value of this brain age measurement as a predictive biomarker, so to try and predict. So we track these individuals over a number of years, so we can go back to their original MRI scan and see if the information in that scan helps us predict whether or not they're going to respond to medication, because medication is by far the main treatment for seizures. Definitely that level of expertise tends to get concentrated in the big imaging centres, what we call a tertiary epilepsy centre. What you tend to find these days is that if someone has difficult to control epilepsy, whether or not they're living out in the countryside or in a remote area, then they will get, hopefully their neurologist will send them to a tertiary epilepsy centre to get imaged. And so we, in New York, it was the same back in Melbourne in Australia. We would often have patients that would come from a long way away to get treated, to see the best epilepsy neurologists that are around.